right, it's 9 o'clock, so let's go ahead and get started. Good morning and welcome to the Epidemiologist Toolkit, the second course in our Epi 101 Epidemiology series. A couple of housekeeping tips before we begin. If you have any technical difficulties during the course of the Polycom, please contact Rich Watson directly. His phone number is 804-864-7179. Again, 804-864-7179. In order to ensure that you receive credit for having completed the course, please make sure that you have signed in using the sign-in sheet available at your location. These sheets will be faxed to us, so please ensure that you write legibly so we can go in and mark you as completed for the course. And then following the course, you'll see a post-assessment and an evaluation and train. We ask that you complete both of these so that we can both gauge your understanding of the material and adjust future courses based on your feedback. And finally, I want to remind you that this course and all future courses in the series will be available online and will be archived indefinitely for future viewing. So without further ado, I'd like to introduce Lex Gibson, Regional Epidemiologist from the Southwest region, and I think he's online in Roanoke. Lex?
Right. Yeah, I'm here.
Okay, you can go ahead and introduce.
Okay. All right, thanks. I'd like to welcome everybody to Epi 101 course. I appreciate the interest you have in epidemiology, which is evidenced in the fact that you've rearranged your schedules to be here. If somebody wants to hit their mute button, please. This course was developed as an overview of epidemiology in the context of public health in response to the request that you made and the training needs assessment survey that was done earlier. This course has been adapted and modified from the E is for Epidemiology Basics for non-epidemiologists. This is a training series from the University of North Carolina. Helping me out today with this presentation is Roanoke Allegheny District Epidemiologist Hope White, and she's got several outbreaks going on in her district, so I'd like to thank her for using her valuable time in assisting me. This training series is for non-epidemiologists with the intention of preparing you to work collaboratively with epidemiologists and public health surveillance personnel. This training series was designed to introduce you to the history and applications of the public health science of epidemiology. It will also introduce and explain terminology, measures, and resources commonly used by practicing epidemiologists. I will have an example at the end of epidemiologic investigation that will capture some of the principles we're going to be reviewing today. The objectives today in part one is of the part two series is gathering epidemiology information and finding epidemiology information. And I want this to be interactive, so there's going to be a couple of times when I'm going to be asking you to do a few things or give me some input, answer a few questions. The first part, we're going to be talking about field work and data and technology. We'll take a 10-minute break where you're going to have a little bit of homework to do also. And then we're going to come back and discuss briefly partners in the practice of epidemiology and use of the media. Throughout the centuries, where there have been health problems, there's always been an effort to identify the cause of those health problems. This effort is the basis of public health specialty called epidemiology. It's the study of the distribution and determinants of states or events in specified populations, and the application of this study in the control of health problems. Purposes of epidemiology are to study risk associated with exposures, identify and control epidemics, and monitor population rates of disease and exposure. If you learn nothing else from this presentation, I'd really like for you to remember these fundamental questions. They're truly the most important questions to have asked and answered in the interview and investigative process. By asking these questions, you should be able to determine the key epidemiological elements of person, place, and time that Angie referred to in session 1. And this is a poem following a short story by Kipling, published in 1902. I keep 6 honest serving men. They taught me all I knew. Their names are what, where, and when, and how, and why, and who. We're going to go over some of the basic what questions, and these might be some questions to ask in a foodborne outbreak. What was on the menu? What did you eat? What is the attack rate? What is the working diagnosis? What were your symptoms? What color was your bowel movement? Can somebody give me another what question that might be asked in a foodborne outbreak? Anybody chime in there?
Who else ate with you?
That's a who.
What's what? Who wants what?
Yeah, that's a good who question. How about a what question?
What time did symptoms occur? What time did you eat?
Very good. Thank you.
How about you eat?
That's a where question.
Okay, oh, that's a what, I'm sorry.
Oh, you're jumping ahead. We're at where now? So, in a foodborne outbreak, here's some examples of where questions. Where was the meal served? Where else have you eaten in the previous 3 days? Where have you traveled in the last 3 days? And what was that other example I just heard of a where question?
Did you eat?
Okay, very good. Any others? Well, you get the idea. In a respiratory outbreak, let's think of some when questions. When did your symptoms start? When did you kiss the pig? And I know that sounds superfluous, but actually we've had 2 suspected outbreaks of the swine flu, and in both of those cases, people were showing their pigs at a 4-H fair, and both of them reported kissing and hugging on their pigs. When did you start antibiotics? What other when questions?
When was the exposure?
It's pretty obvious, yeah. Thank you. Some how questions to ask in a diarrheal outbreak. How long have you had diarrhea? How many children are in the daycare? How many students are absent? Other how questions? How about Chesterfield? What was that how question? Right. How many times a day did you have diarrhea? Why questions? Why questions are very useful, but you've got to be careful when asking why questions. The word why means for what cause, reason, or purpose, and when we ask why questions, we're basically asking these questions because we're looking for a reason in regard to an action, and they can easily put people on the defensive. And I've got some examples here, and these are just general why questions. They can apply to anything. Why do you think your illness was caused by restaurant A? Why do you think the dog bit you? Why do you think only this group of residents became ill? What are some other examples of some why questions?
Good. Didn't taste right. We hear that all the time when they say, oh, I ate this, but it didn't taste right, so why did you continue to eat it?
Yeah. Yeah, we do hear that a lot, don't we? Anybody else for why question? I can give you an example of what I was talking about as far as putting people on the defensive. You might ask the cook, well, why did you cook this when you know that the temperatures weren't correct? Or why did you go on and serve this after the food had been sitting out for 6 hours at 82 degrees? Those can put people on the defensive, and you might just shut them down. So you've got to be careful in asking that question. Some who questions to ask in a rash illness outbreak. Who else was at the birthday party? Who flew on the plane with you? Who else became ill? Who was in the car with you? And somebody jump in there with another who question.
Who are your closest relatives?
Who cooked the food?
Okay, good one. I heard somebody else in the background there. They want to jump in?
I said, who cooked the food?
Yeah, that's a good one. Anybody else?
As far as travel, I'd ask them, were they around anybody that exhibited symptoms, that was coughing and or maybe had to get up and get sick, etc. If they were just aware of their environment.
Yeah, who's a really important question to ask when you're trying to flush out your contacts. Obviously, you want names and contact information. Let's talk a little bit about the home visit in the interview process. The home visit or interview is one of the most important methods of getting data. It's always a good policy to ensure that the interviewee is comfortable with the level of privacy and surroundings in which the interview is taking place. Often it's difficult to walk up to someone you've just met and ask them if they have diarrhea, much less how many times a day they're having diarrhea, what's their diarrhea smell like, and what color is it. How do we do this? I always try and establish some kind of rapport with the client before jumping into interview questions. Often this can be accomplished by simply asking, how are you feeling? And then just sit back and listen and don't say a word. I'm sure those of you that have actually gone on home visits and done interviews realize that you'll hear a lot more than what you want to hear, and you'll hear a lot of things that aren't germane to the investigation that you're conducting. So oftentimes you have to be able to take control of that situation. Some of the methods I've used when interviewing people is I'll ask them about a pet if it's evident they have one, or maybe ask about their cell or smartphone if they're preoccupied with it. You know how people are always fiddling with their phones nowadays. I might just ask a simple question. What kind of phone is that? How do you like it? Being out in the country in the past, I've asked people about their hunting dogs. I've asked them about their tractor as well. So you need to tailor those type of things and consider that the population that you're interviewing. Right now, I'd like to take 2 or 3 minutes and y'all just discuss this within your site there and talk about some methods that you've used to establish rapport in the past. And if you would, after a couple of minutes, I'll come back on here, and if you could share that with the rest, I think that would be helpful. I'm always up for learning new ways to establish rapport with people. So take a few minutes and talk about that. If there's a district Epi there, if they could facilitate that conversation, I would appreciate it. Thanks.
This is Virginia Beach. We'll start.
Okay.
Our Epi had to step away, but I'll fill in. I think the most important thing is establishing communication right up front, in a very non-threatening way. Explain why you're calling and what you're going to need, what type of information, and if they're really busy, maybe see if you could get back at another time or they could call you back. Using calendars, receipts from the grocery store, restaurants, anywhere where they may have eaten out. You just have to be creative sometimes to help them then identify things that may be important to that investigation.
Right. Somebody else?
This is Roanoke. I was asking whether it would be appropriate as the interviewer to say, yeah, I remember when this happened to me, like if you're discussing diarrhea, I remember when this happened and this is how I felt. And that way you could develop rapport and hopefully get the person to open up with you. So it seemed like that would be a good technique to use if you're willing to share that information.
Yeah, I think empathy is showing empathy for the patient is pretty important technique too. Who else has got something to share?
Hi, Les. This is Rhonda Pruitt down in Southside.
Rhonda.
And one of the things that I always do, oftentimes when you're contacting somebody for a follow-up investigation, one of their fears immediately is that they're in trouble or that you're going to get somebody else in trouble. And so I always try to just, put that to ease, let them know the reason that I'm calling, and, basically we're trying to determine what your exposure was, what possibly would have made you sick, and just trying to prevent the spread of illness to other people. And a lot of times that goes a long ways towards, getting them to open up once they know that you're not doing anything punitive towards them.
Yeah, that's an important point. Thank you.
This is Virginia Beach, and I supervise home visiting programs. And I found we don't go in just to do interviews for investigation, but we've found over the years that when you do set up that rapport, that I call it the Sherlock Holmes and Watson approach. They're your partner. They have valid information, and they have an expert in their lives that can offer you information, and you can offer them information. So when they feel valued and they feel that they have something important, and then they engage with you in finding the best answer, no matter whether it's an investigation, whether it's raising a child, whether it's family, engaging a family in a health activity. So that's what I have to offer.
Thank you. Thank you. It's very important. Who else has got something different? I'm really enjoying hearing these different techniques.
Well, we're here in Fairfax with some communicable disease staff, public health nurses, environmental health specialists, and others. And we had a couple of really interesting comments during discussion, I think. Dave, you want to share about bias?
I originally started with trying to dispel the bias that occurs especially attendees of an event where there is an illness outbreak. They're chatting in the background and trying to work. It's that communication, working to identify the person who we should be in contact with, one person that we can get the information from, so that we can answer those questions that we addressed earlier in the presentation, answer those appropriately up front, so we can start developing the questionnaire set that we'll go forward and interview the cases.
Point. Very good point.
word about.
My name is Paul Billowis. I mentioned that you could bring up the amount of foodborne illness outbreaks in our country, how many people have been sickened by it, hospitalized. That would be a little more report.
Would you mind repeating that? There was some paper shuffling going on, and it was kind of hard to understand.
My name is Paul Billowis from Health Department, Fairfax County. And I mentioned that they could bring up the fact that there's a lot of, I get to actually get the number of how many foodborne illness outbreaks there are in our country, how many sicknesses that result in hospitalizations. Bring up some like statistics.
Okay, I like statistics. Good idea. I've never tried that. How about somebody from the Southwest? I'm sorry, is Fairfax got some more?
I'm one of the CD nurses here, and I was just going to say, I always explain why I'm calling, and then let them know I'm providing education so they know how not to spread this to family and friends, and people usually really appreciate that.
Yeah.
They feel like they're helping out the, instead of just they become part of the solution to the issue that's going on rather than just a victim.
Okay.
Fauquier County, we said assure personal privacy. Make sure that where you're at is in a private area, and also that their names and such, we're looking for investigation. We're not looking to publicize names or anything.
Pretty important. I've run into that issue on several occasions myself. How about from the eastern and southwest region? I don't know if we've heard from them yet. Actually, we have. Virginia Beach, that's right. Yeah. All right, well, I think that was very valuable. I appreciate that. And the last bullet on this slide is be alert to your surroundings, and that's important for safety reasons, as well as giving you clues to the source of illness or clues to others possibly exposed. If you're in the house and it's not a phone interview, look around and see if there's pictures of people scattered around the house or on top of the mantle. Look to see if there's children's toys scattered all over the place, all over the floor. These could give you clues as to who else might have been possibly exposed.
Hey Les, this is Rhonda Pruitt down in Southside. I got something to add just to that. I was doing an outbreak investigation with it was salmonella, and it was in a food worker. And I had spoken to her on the phone, but I was going out to the home to interview her and to take some specimen collection kits. When I had spoken to her on the phone to discuss her hygiene habits, she assured me, that she had really careful hygiene. When I went out to the home, there were 2 water heaters sitting in the front yard. And I asked her, I said, are you, what's going on? Are you replacing your water heater? She said, yeah, ours has been broken for a long time and we don't have one now. So, everything's just cold water. So that was an important piece of information.
Well, tell me this, Rhonda. Did you do a phone interview with her and then go out to her house for a home visit? Did something trigger that home visit that occurred during the telephone call?
Yeah, the fact that her son, within 3 or 4 days after she had salmonella, her son also was stool culture positive for salmonella. And I thought, okay, there's more going on here. Obviously, he's been exposed. I'm wondering if this is more of a hygiene issue. So, I followed up with her again over the phone, and I asked her, I said, would it be okay if I just came out to the home, to meet with you both and just in a more private setting, get a little bit more information from you?
Yeah, I love it when things like that happen. I remember one time I was just following up on a routine case of acute hepatitis B, and the person was hospitalized, and when I called him up, miraculously, he just got hepatitis B. He had no risk factors whatsoever, and I just didn't like the way the conversation was going, so I made a home visit over to the hospital, and of course, he has jailhouse tattoos all over him, and after I'd called him on that, he admitted, he was an IV drug user, had multiple sex partners, blah, 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 blah. But I love catching people when they're being a little dishonest with you in an interview like that. Or maybe not being dishonest, but not having all the facts presented to you in a correct manner. We'll move on to the next slide, and thanks for everybody's input on that. What do we do with the interview data? Data from the interview is collected using a standard questionnaire and entering it into a database or spreadsheet. Often during an investigation where everyone has access to email or the web, we'll use an online tool called SurveyMonkey, where the interviewee goes directly to the SurveyMonkey website and enters the data themselves. The con to this method is that there's no person-to-person interaction to fully explain the questions, but there is a big pro, and that is that a large number of interviews can be done quickly. Line list. A lot of people just get disgusted when we mention line list, but they're very important, and they're most often put into an Excel spreadsheet. During the initial flurry of activity during an investigation, counting beans is probably not the most desirable thing to work on, but it's important for several reasons. First and foremost is your boss and their boss are probably going to want numbers. Also, if this outbreak that you're working on is worthy of media attention, they're going to be wanting to call up, and they're going to want numbers also. But the legitimate reason for having the line list is it's going to aid in your analysis of the data.
Lex, I don't know exactly what you mean by a line list. Could you define that, please?
Sure, I'm sorry. Yeah, a line list would be is you're identifying contacts or people exposed or people that have an illness. It's really very simple. What it is an Excel file with, let's say, last name, first name, age, race, sex, a list of risk factors, and you have a checkbox, yes or no, if they have this risk factor, if they don't have this risk factor. In addition, you would have the date of onset. You would write that down. It's a way to organize all the data you're collected from the standardized questionnaire or from a form that you've developed so that you ask the same questions to everybody during the interview process. Does that help?
Yes, thank you.
Okay. I don't mean to trivialize the line list when I say the media is going to want numbers and that your boss is going to want numbers and their boss is going to want numbers, but in reality that's the case. But the main thrust of the line list is that it's really going to keep you organized and aids in the analysis of the data. Let's move on to the investigative team. Members of the team should include the district epidemiologist, environmental health, nursing. We like to have administrative or clerical help, someone to collect lab specimens if necessary. And often this team can be expanded to include the health director, the Division of Surveillance and Investigation, CDC, or if you need somebody from Public Works or Emergency Management, you can add. Jeanette, whoever you want to the team. You want to, could you mute your button, please? Thanks. Anybody else does anybody have any other ideas and people that could be included on the investigative team?
Les, sometimes, the MRC, and then also you may have to get involved with like the Department of Agriculture, especially if you like tracing oysters and, you know, their origins and things like that. There's other departments that may get pulled in.
Right.
We work with our emergency planner a lot also here. If it's going to be a large-scale investigation of an outbreak, like involving a restaurant or involving a public place, then we always involve our emergency planner.
Yeah, I've always found the emergency planner to be very helpful also, especially in a logistics type of situation too.
And here in the Eastern region, a lot of times we involve our military partners. Big military.
Oh, good. All right, thank you.
And also here in Fairfax, we often involve our regional Epi if it involves other jurisdictions or if it's out of state.
Very much. Next slide. The epidemiologist and the team, they generate the hypothesis, which requires making judgments about linkages between exposure and outcome. They're more than likely going to be the ones that interpret the data that is collected and analyzed, and they can identify or correct mistakes and interpret the results of statistical analysis and of laboratory tests. They also make decisions. Decisions can be based upon epidemiological and laboratory evidence to determine if an epidemic is in progress or not in progress, and to recommend the appropriate control measures. For example, if we're talking about surveillance, only humans, not computers, will be familiar with the surrounding population, the historical disease patterns, and existing or new reporting systems. By being familiar with ongoing surveillance trends over a number of years, epidemiologists will know whether or not a spike in a line graph is indicative of an outbreak versus the result of some external factor like an enhanced reporting system. Okay, next slide. Let's consider the epidemiologist's role on this team. At a local level, some of these tasks may necessarily fall on the shoulders of the communicable disease nurse. Thus, an epidemiologist might not even be in the team, but the communicable disease nurse will fulfill that role of the epidemiologist. The role involves determining whether or not an outbreak is taking place, just as an epidemiologist would do. And when an elevated number of cases of foodborne illness rise, they make that determination. The person occupying the epidemiologist role determines the existence of an outbreak. So the communicable disease nurse would be doing that in a situation where the epidemiologist is not on the team. The person in the epidemiologist role also creates a case definition, which provides objective criteria as to whether a given individual should be considered a case in the outbreak. For example, a case definition of a diarrheal illness associated with an unknown store-purchased food item might be onset of illness on or after February 1st, 2012, with at least 2 of the following symptoms: diarrhea, fever, and vomiting. The epidemiologist or communicable disease nurse conducts interviews with cases, family members, contacts, and controls. generates a hypothesis about the cause of the outbreak, and if needed, designs a study such as a cohort or case control study to better understand the cause of the outbreak. Finally, the epidemiologist analyzes, reviews, and interprets the data. Next slide, please. Environmental health specialist, very important role on the team. The environmental health specialists have a unique role in outbreak investigations. While an epidemiologist tries to pinpoint whether or not a particular food item or exposure is a source of infection, the work of the environmental health specialist can answer the question, why? Why was this food responsible for infection? And answering the why enables public health professionals to know how to contain an outbreak and prevent future outbreaks via short and long-term control measures. Environmental health specialists answer the why question with activities that include collecting and testing of food, water, and other environmental elements of interest from a restaurant, a home, or other venue so that they can be tested for pathogens in the laboratory. And inspection of the food service establishments for sanitation violations or deficiencies. For example, the environmental health specialist would take samples of food items implicated by the investigation, examine restaurant refrigeration practices and temperatures, and review the records of employee training. Now that's kind of a routine type of example of what the environmental health specialist does. But in the context of an outbreak investigation, and an environmental health assessment is a systematic, detailed, science-based evaluation of environmental factors that contributed to the transmission of a particular disease in an outbreak or setting. It is not a general inspection of operating procedures or sanitary conditions like that used for licensing or an assisted living facility at a restaurant. Rather, it focuses on the problem at hand and considers how the causative agent, host factors, and environmental conditions interacted to result with the problem. I'm assuming that just about everybody here works very closely with their environmental health program, especially in foodborne outbreaks. I know I've always made that a priority. The public health laboratory staff role in an outbreak investigation team. Most of us don't have access anymore to one of the 13 health district-based labs, but that doesn't mean we still don't have a very strong partner in DCLS. And they do make quite a good use of strains of DNA by pulsed field gel electrophoresis, or PFGE. The ability to identify a specific strain of a pathogen allows epidemiologists to determine whether or not the cases they're seeing are all part of the same outbreak. Furthermore, there's a national system of sharing data from clinical PFGE samples called PulseNet. Using this national database, epidemiologists can determine whether or not outbreaks are occurring simultaneously in other states. This can be essential to tracing the source of infection for something like a foodborne illness if a supplier in one state has sent produce to multiple other states. Excuse me. This national system allows for the detection of an outbreak even when there are only a few cases in a variety of different geographical areas. Can anybody give me some examples of recent multi-state outbreaks that you've been involved with? I know we've had a cyclospora, a multi-state cyclospora outbreak. I'm not sure if we've had any cases identified in Virginia in that. But in the past, I know we've had contaminated peanut butter. Can you think of anything else?
Boy Scout E. coli. Boy Scout E. coli. Like some widespread.
Did you say the Boy Scout E. coli?
Boy Scout. Boy Scout.
Oh yeah, yeah.
Answer here in Richmond as well. It was what did you say?
There was an outbreak of E. coli in a Boy Scout camp in the western region of the state, and we had Boy Scouts from. I'm assuming that's the one you're talking about, but we had scouts from multiple states coming in that partook of some contaminated beef. Actually, what happened was the beef was contaminated with E. coli. That it was undercooked. Is that the outbreak you were talking about? Whoever said that?
Yeah, that was it.
And here in Richmond, we had an example of the fungal outbreak with contaminated steroid products.
Oh, I remember that one too. Yeah.
Salmonella that was associated with the poultry from Florida. There was a poultry salmonella outbreak that went on earlier this year. We had a case that came up here.
Oh, okay. And where's that?
In Fairfax, we had that.
Fairfax, okay.
Involved last year with the Trader Joe peanut butter, and I think the only person, or at least early on, that actually collected a jar of peanut butter that DCLS tested positive for the same type of salmonella. So that was exciting that I got to take pictures of the peanut butter jar and send it to Seth, and I was involved in that. So we've had quite a few with the, I think, frozen pizzas and dog food, and I can't even think of all the pot pies, over the years with salmonella and some of the different enteric diseases.
Yeah. I can recall sprouts and cantaloupes, berries, the peanut butter, as you mentioned, different kinds of beef products. I mean, the list goes on and on and on. It seems like ever since PulseNet came into existence, our job has become geometrically and exponentially more difficult. Next slide, please. Another valuable part of the team is DSI, which is who the regional EPIs, including myself, that's who we work for. And they can provide a lot of support and expertise during an outbreak. The mission of DSI is to serve the citizens of Virginia by monitoring for the occurrence of reportable or emerging diseases or suspected outbreaks. DSI, they're responsible for a wide range of conditions, which include, but is not limited to respiratory infections, such as influenza, both seasonal and pandemic, Legionella, gastrointestinal illnesses such as norovirus, Salmonella, typhoid, Shigella, agents that may be used for bioterrorism, anthrax, tularemia, smallpox, other conditions of public health importance, such as emerging infectious diseases, invasive bacterial infections, drug-resistant infections, and outbreaks. That's kind of a catch-all, other conditions of public health importance. And infections and other health conditions potentially associated with healthcare facilities. In summary, DSI can provide you a lot of support and expertise during your outbreak. Next slide. Several programs within DSI. The surveillance program, which provides guidance and surveillance laws, regulations, and methods to local health departments and healthcare providers. We investigate potential clusters identified through laboratory-based surveillance, and we can support statewide disease reporting systems, or we do support statewide disease reporting systems, such as VEDS. Also, there's syndromic surveillance in Essence, DiSense, outbreak management, where we coordinate and augment local health department responses for outbreak investigation management. We can coordinate and contribute to the development of materials to inform healthcare professionals in the public on health issues. And some of the ways we do that is an annual summary of communicable disease statistics and regular ad hoc statistical reports. DSI provides you with the fact sheets that you're often handing out to your patients when you're working your outbreaks. They respond to public inquiries and provide consultation with local health departments in the detection, prevention, and control of community diseases of public health interest. I also work with emergency planning and response. We work with VDH programs to develop educational materials to help businesses and the public prepare for and respond to communicable disease emergencies. There's an infection control program, or HAI program, which is excellent in assisting local health departments in providing consultation to medical facilities, schools, businesses, and to identify the sources of outbreaks and control the spread of the disease. Training. This 4-part series in Epi 101 is a good example of the training that DSI puts together. We collaborate with local and state agencies to train staff in emergent public health issues. Next slide. We're going to shift gears here and move into data and technology now. And this is going to be a little interactive also. But I want to take a look at one of the most powerful toolkits available to us in Virginia. It's called the Epi Toolkit, and it's on the DSI homepage. Do most of you have access to a computer with access to the intranet there in where you're watching this? Because after we review, somebody want to respond?
We do in Richmond.
Okay.
We do not.
No, we don't in Fauquier.
Okay. I'm trying to figure out how to go on if only one person has it and one person doesn't, because I was going to give you a 10-minute break to look at everything. You don't? Okay.
We have it at Thomas Jefferson.
Okay, well, we might take a shorter break than what I was envisioning, and some of you can work on this, and some of you can just take a 5 or 10 minute break. But I want to go over the field kit. I'm hoping that most of you have seen this before. Those that probably haven't worked in any outbreaks probably haven't. But let's go on and explore a few of the things in the field kit. Hope, if you want to bring that up. This is the URL, VDH web epi surveillance field kit.asap. And it's pretty simple. And if you want to check, if you want to click on Disease Guidelines, Hope, the Disease Control Manual is a magnificent document. It's got guidelines and the follow-up of all the reportable diseases in Virginia, plus several other conditions. And if you just want to pick something, pertussis or whatever, to pull up, you can see that under pertussis we have the pertussis guidelines for follow-up, and also besides, if you want to click on that, besides guidelines for follow-up, it will tell you the incubation period, give you some background on the disease. I do want to caution you, though, that these are cookie-cutter guidelines, and you're encouraged when you're investigating cases of any particular disease. If someone tells you something that makes you want to take a left turn, I encourage you to go on and explore other routes besides what's on the guidelines. But they do give you an excellent type of basis for follow-up of any outbreak or disease. I don't care how long you've been working with communicable disease program. This is constantly being updated with new information, and I don't know of anybody that can keep all of this in their head, so this is a very good resource. If you want to back up some to this, hit the back button one more time, please. Also, there's a quick link there in the gray box, which will give you quick access to the outbreak surveillance form. So whenever you have an outbreak, you need to document that outbreak. And instead of searching through hard copies, this is a quick way to find those outbreak forms. There's one for respiratory outbreaks. There's one for acute environmental exposure outbreaks. There's one for diarrheal illness in a facility. There's a number of different outbreaks. There's other outbreaks, which is a type of catch-all. And this is just a good clearinghouse where you can pick out those. If you'll hit the back button again and go to the DCM, the main page. Go back again. And if you'll just click on surveillance systems, we'll see what's in there. Surveillance systems, those that use Essence and VEDS, this is a good way to get a quick way to get access to those on the web. If you click on contacts, that gives you the main numbers for DSI. There's a column for training and tutorials, the divisions within the Office of Epidemiology. There's a section on regulations. This is a pretty powerful tool, and I'd recommend that all of you take some time and explore this on your own. All right, let's talk about surveillance systems and questionnaire surveys or interviews, medical records, and health records, because there's many sources of data, and surveillance data does play a key role in public health operations and how we make our decisions. Next slide. Definition for surveillance is the ongoing systematic collection, analysis, and interpretation of health data essential to the planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of this information to those that need to know. Big three things in this is it's an ongoing process. We just don't collect data once in a surveillance system. It continues over years. We use the data we collect, and we distribute that data. are several tangible applications of surveillance data. Specifically, surveillance data can be used to determine a baseline for the detection of epidemics or early detection of epidemics, and to estimate the magnitude and geographical distribution of a health system. However, it's widely accepted that surveillance data may just be the tip of the iceberg in some instances. For example, food poisoning can only be, I don't particularly like that word, but I'm going to use it anyway. Food poisoning cases can only be documented if they're reported. Is everyone here that's ever had a case of food poisoning notified their local health department, or do you know somebody that's had that didn't notify their local health department? Surveillance data can also be used to facilitate planning by providing evidence for establishing public health priorities. There are limits to surveillance data, but I'm not going to talk about those now. I believe Denise Sockwell is going to be talking about surveillance in session 4. But let's take a quick example, take a look at 2 quick examples in the form of a graph and a map of how surveillance data can be used. This is a line graph showing hepatitis A incidence rates. Has the pink gone away now? It looks like it has. This graph shows hepatitis A incidence rates based on surveillance data for the state of Colorado over a 10-year period of time. You can look at this and you can see how it helps assess the magnitude of occurrence of cases each year, and it can provide an easy comparison to the national rate. Next. This map depicts salmonella surveillance data for the state of North Carolina for a single year. What this does, it tells us about the geographic distribution of disease.
This is Three Rivers. In answer to your question, the pink is still there, and also throughout your presentation, your lettering is red, which is really hard to see. I don't know whether that's what the color is on your PowerPoint, but that's what we're seeing.
That's yellow.
We're seeing it. That's what I thought, because I'm looking at it on my laptop and it's yellow, but on the screen it's red and it's hard to see.
Well, I apologize for that. I'm not a Polycom guy, so I'm not sure exactly what's going on here, but no, that'll take more time. So we'll just have to move on. I do apologize. Data management and analysis. We've talked about the need to collect data, outbreak investigations, contact tracing, and case follow-up. But what do we do with all that data? Broadly speaking, epidemiologists and biostatisticians use statistical analysis software to analyze, graph, or map data from outbreak investigations and disease surveillance. Epidemiologists may work with biostatisticians within state and local health departments or neighboring academic institutions to generate data summaries and statistical lists. Some of the software commonly used is EpiInfo, SAS, SPSS, Stata. But EpiInfo is a free software from CDC. It's user-friendly even for the non-epidemiologists. With SAS and a few of the other software packages, and I don't mean to make any of you SAS people mad, but you do have to learn and understand a program language. In EpiInfo, you just use window-based commands to analyze the data. EpiInfo software, it's public domain, it's free. It was specifically developed by CDC for public health professionals to use in the field. They do have excellent support, and it can be downloaded at the URL www.cdc.gov /EpiInfo, and that's EPIINFO. Software features of EpiInfo include a relational database structure, on-screen data entry forms, data analysis, graphing, and mapping. The map that we saw earlier of North Carolina was done in EpiInfo. Next slide. Software is used to store databases, such as data collected from surveillance system, data gathered from outbreak investigations, or data contained in medical records. Statistical software can also be used to generate descriptive statistics such as frequencies, proportions, rates, p-values, and that's one of the primary reasons for using this type of statistical software is to generate statistics. Let's go to the next slide. Okay, the last session, and we'll need to run through this fairly quickly, is partners in the practice of epidemiology, the media, Centers for Disease Control, and an example investigation demonstrating some of the principles we've gone through. Partners in the practice of epidemiology. Next slide. These include public health response teams, first responders, environmental health specialists, public health laboratory staff. Many districts have a formal structure for public health or outbreak response teams. These teams are most often multidisciplinary teams with special training that can be rapidly deployed anywhere during a public health emergency. And emergencies can entail anything from outbreaks and natural disasters to chemical spills and bioterror incidents. These teams often involve state, regional, and local emergency responders. First responders, the traditional list of responders such as fire department, law enforcement, hazmat, and emergency medical services. Sometimes the Department of Transportation and the EPA are traditional first responders' responsibility too. But with the increased emphasis on preparedness, public health monitoring and response is expanded to include organizations that might not be traditionally thought of as first responders, but who in reality have a key role in initiating or executing actions as part of the immediate public health response. These non-traditional first responders include staff in hospitals, public health laboratories, public works departments. For example, if a mass water contamination event occurred, the local hospital may be quickly overwhelmed with patients. Public health laboratories would be called upon to rapidly test a large quantity of specimens, and the public water supply would need to take action to prevent contaminated water from continued distribution to the community. Next slide. Let's move on to the media. Next slide. The media can be your friend, or they can really hamper an investigation. So if you have an outbreak that is worthy of media attention, I strongly recommend that you appoint somebody to be your media spokesman, because you'll never get anything done if you don't do that. But the three key applications of the media are risk and crisis communication, reaching people potentially exposed in an outbreak, and press releases. It's important to note that risk and crisis communication are related, yet different. Risk communication is typically used to address an adverse outcome and the probability of that outcome occurring for an individual. Risk communication can be used to help an individual make a choice about whether or not to undergo a medical treatment, continue to live next to a nuclear power plant, or elect to vaccinate a healthy baby. In some instances, risk communication is used to help individuals adjust to the knowledge that something has occurred in their past, such as exposure to harmful carcinogens, and may put them at a greater risk for cancer in the future. Crisis communication is used when an event occurs unexpectedly. The public health organization is experiencing the crisis as well as the general population, and leaders must communicate accurate information and guidance regarding appropriate actions. A second application of using the media is reaching people potentially exposed in an outbreak. And a third application is press releases. For example, many states, including Virginia, we have numerous public PIOs or public information officers located at the state health department or the regional, as well as regional PIOs in major cities or counties. PIOs work with health department staff, including epidemiologists, to craft and disseminate messages to the public in the form of press releases. Next slide, please. I know you're really not going to be able to see this, but what this is, it's a screenshot of recent press releases in Virginia, and you can, well, I was going to say you can see, but you really can't see. From what I've been told, that there's a diverse range of topics. One of these warnings is for consumers not to eat oysters harvested on Fisherman's Island. There's also a release with safety tips for the upcoming fair season, and there's also a notice about a new web-based surveillance system that's launched in August. Next slide. Center for Disease Control has 20 specialized centers, including institutes and offices. Its mission is to protect the health through health promotion, prevention of disease, injury and disability, and preparedness. I'll tell you what, since our time's about up, I'm going to skip through CDC. I'm going to run through it real quick so I can hit our example outbreak. But some of the tools are training, technical support, surveillance and reporting. Next slide. And here's a couple of websites. CDC. Let's talk about, now let's go to our example, the fungal meningitis outbreak that recently occurred. This investigation of fungal meningitis and infections associated with injections in a peripheral joint source such as the knee or shoulder or ankle occurred in September of 2012, and it continues to this day. In fact, it continues into this day. Where 749 cases were identified in the U.S., and to date, 54 cases have been identified in Virginia. Two facilities, both located in Southwest Virginia, were where the contaminated methylprednisone was distributed to people that were distributed throughout Virginia. Over 600 people were exposed during this, and our job during this outbreak was to monitor those that were exposed. Who are the partners and resources we used during this investigation? There was a lot of them, and I hope I haven't missed any, but the local health departments, DSI and the Office of Epidemiology, DCLS, the media, the medical examiner, Center for Disease Control, local hospitals and labs, the MRC, the hospital associations, the Office of Emergency Preparedness, PIOs, the Office of Risk Communication and Education, imaging centers, public health planners. We had a lot of partners. And if you'll, next slide. And again, here are some media releases. I know you can't see these, but all of these have to do with the fungal meningitis outbreaks. We were constantly updating the public and physicians as to the progress of this outbreak. And we had we assembled a lot of dedicated and knowledgeable people for this epidemiology response team to this outbreak. They used interviewing skills to interview residents, and they employed outbreak investigation techniques and data analysis skills. In summary, partners in the community play a strong role in collaborating on efforts to carry out investigations in a variety of settings. First responders, other public health professionals such as communicable disease nurses, environmental health specialists, laboratorians are vital to communicable disease public health surveillance and outbreak investigation. Epidemiologists can use the media as a tool for communicating with public health professionals, medical professionals, and the populations affected by the outbreak or other health hazard. Last but not least, you should now understand how DSI and the Center for Disease Control serve as the lead resource for training, technical support, and surveillance and reporting for epidemiologists and collaborators who tackle the challenges of day-to-day public health outbreaks as well as public health emergencies that may arise. And I want to thank everybody for participating today. I believe our time is, well, it's up, but are there any questions? All right, well, thank you for your time.